What do you view as the most pressing health care problem in the United States?
Well, it's the fact that the system that we have today isn't working and nobody's happy. So changes have to come.
The United States slipped to number 37 in the world's healthcare systems. It's true. 37 is the ranking according to the World Health Organization's latest data on 191 countries. It's based on general health level, patient satisfaction, access, and how it's paid for.
The direction that we're going in, if we don't change it, the system will not be sustainable because we can't afford it.
We all know that healthcare costs have been increasing. If you look between 1960 and today, healthcare costs more than tripled as a share of the economy, from under 5% of GDP, or gross domestic product, in 1960 to more than 15% today.
I want to talk about health care in general, but I'd just like to acknowledge that the anxiety everybody's feeling is warranted. This is a big problem, and it's going to require some serious focus, both socially and politically, and I will add, parenthetically, economically. It is the kind of problem that, if it's left unchecked, could erode the solvency of a great economy. It is the scale of a problem that could undermine prosperity. It is already redefining our nation's macroeconomic equation. We're seeing substantially less money, I believe, that going into education, into things like innovation, R&D, investment in other areas because of the flow of funds and economic value into health care.
I would argue that the most serious threat to the United States is not someone hiding in a cave in Afghanistan or Pakistan, but our own fiscal irresponsibility.
As Comptroller General of the United States, he runs the Government Accountability Office, the GAO, which audits the government's books and serves as the investigative arm of the U.S. Congress.
I'm going to show you some numbers. They're all big and they're all bad.
So bad that Walker has given up on elected officials and taken his message directly to taxpayers and opinion makers.
Dave Walker, how are you? Good to see you.
Hoping to shape the debate in the next presidential election.
You know, the American people, I tell you, we've been to 13 cities outside of Washington with the Fiscal Wake-Up Tour. They are absolutely starved for two things: the truth and leadership.
In terms of overall healthcare spending, after the share of healthcare spending in the economy more than tripled between 1960 and today, we project that it would more than double again between today and 2035, rising to more than 30% by that year. In terms of Medicare and Medicaid, we project that spending today, which is 4% of the economy, would more than triple by 2050, reaching 12% of the economy by that year, and almost 19% of the economy, or roughly 19% of the economy, by the end of the projection window.
Beginning next year and for 20 years thereafter, 78 million Americans will become pensioners and medical dependents of the U.S. taxpayer.
The first baby boomer will reach 62 and be eligible for early retirement under Social Security January 1, 2008. They'll be eligible for Medicare just 3 years later. And when those boomers start retiring en masse, then that will be a tsunami of spending that could swamp our ship of state if we don't get serious.
We have been largely misdiagnosing the nation's fiscal problem, and I am guilty of this, as are many of my former colleagues in the think tank community and elsewhere. In the media, the nation's long-term fiscal problem is typically described as being driven mostly by the coming retirement of the baby boomers, the tidal wave of aging. And while that is a factor, it is not even close to the most important factor. This chart shows you the pure effect of the aging distribution of the population, so that is that the population is growing older, in that dark blue line, or the dark blue area. The light blue area is the effect of cost growth above and beyond aging and above and beyond GDP growth. And I think it's pretty obvious from the graph that while aging is there, or the effect of the aging population is present, it's not the dominant force. And in fact, by the end of the projection window, the aging distribution, or the aging of the population distribution accounts for only about 10% of the projected increase in Medicare and Medicaid costs. So that is not where the money is. The money is in the light blue area, and we are paying far too little attention to what could help bend that curve in the light blue area, and far too much attention to, in effect, the impact of that dark blue area.
The real problem, Steve, is healthcare cost. Our healthcare problem is much more significant than Social Security.
What do you mean by that?
By that I mean that the Medicare problem is 5 times greater than the Social Security problem.
The problem with Medicare, Walker says, is people keep living longer and medical costs keep rising at twice the rate of inflation. But instead of dealing with the problem, he says the President and the Congress made things much worse just 3 years ago when they expanded the Medicare program to include prescription drug coverage.
The prescription drug bill was probably the most fiscally irresponsible piece of legislation since the 1960s. The
Why?
imbalance, well, because we've promised way more that we can afford to keep. $8 trillion added to what was already a $15 to $20 trillion underfunding. We're not being realistic. We can't afford the promises we've already made, much less to be able to piling on top of them.
With one stroke of the pen, Walker says the federal government increased existing Medicare obligations nearly 40% over the next 75 years.
We'd have to have $8 trillion today invested at Treasury rates to deliver on that promise.
And how much do we have?
Zip.
Walker says we have promised almost unlimited health care to senior citizens who never see the bills, and the government is already borrowing money to pay them. He says the system is unsustainable.
It's the #1 fiscal challenge for the federal government. It's the #1 fiscal challenge for state governments, and it's the #1 competitiveness challenge for American business. We're going to have to dramatically and fundamentally reform our healthcare system in installments over the next 20 years.
And if we don't?
And if we don't, it could bankrupt America.
You're probably expecting to hear from someone who disagrees with the Comptroller General's numbers, projections, and analysis. But hardly anyone does. He is accompanied on the wake-up tour by economists from the Conservative Heritage Foundation, the left-leaning Brookings Institution, and the nonpartisan Concord Coalition.
Let's go.
The only dissenters seem to be a small minority of economists who believe either that the U.S. can grow its way out of the problem or that Walker is overstating it.
Unfortunately, they don't get it. I don't know anybody who has done their homework, has researched history, and who's good at math, who would tell you that we can grow our way out of this problem.
Economic growth alone is unlikely to solve the nation's impending fiscal problems.
Federal Reserve Chairman Ben Bernanke validated much of Walker's take on the situation at congressional hearings this year, and so did ranking Republicans and Democrats on the Senate Budget Committee.
This is not just about numbers. We are mortgaging the future of our children and grandchildren at record rates, and that is not only an issue of fiscal irresponsibility, it's an issue of immorality.